My caregiving journey started officially when I was 49 years old, and I left work to help my mom caregive for my dad, who had late Alzheimer's. She really needed some help, and I left work to do that. After my dad died in 2011, I started caregiving for my mom, who fell, hit her head. That resulted in an MRI scan and CT scan, which diagnosed her with brain tumors, only to find out in recovery she had stage 4 lung cancer and was giving 4 to 6 months to live, so I became her primary caregiver. 2 years after that, my husband was diagnosed with vascular dementia due to a traumatic brain injury that he sustained while we were building our house, what was supposed to be our retirement home. So that was over a 12-year period, and that was a tough go. I'm also being penalized through CPP for not working. So the loss of my income, being penalized through CPP, there's no other income that is available to me as a full-time caregiver at home. And I'm in my 50s. So that cost to me is huge. I'm advocating that caregivers for adults who have disabilities, both mental or physical, who choose to leave the workforce or are forced to leave the workforce to take care of their loved ones, that they be considered similar to parents who have had children. And under the age, there's a policy within the CPP legislation that says that those parents can leave if the child is under the age of 7 for a period of 5 years, and they will not be penalized for the 5 years that they've been out of the workforce. My advocacy work is saying we need to have that same policy and legislation for caregivers who are looking after adults who have disabilities or mental health, and they choose to leave the workforce. They should not be penalized for that. We are saving the healthcare system billions of dollars, but unfortunately we're leaving the workforce to do that. I can remember sitting on the sofa reading to my dad when he had late-stage dementia, Alzheimer's, with both of our feet up on the stool. And I thought to myself, I will never get this moment back ever again. Feeding my mom her last meals, or my husband, I will never get those moments back again. It makes me smile when I think of those moments. I feel the joy inside. I was blessed to have that time. It's not just money that's going to fix the problem. It's policies that need to be changed, policies that are too rigid, silos that are working separately and not integrated. Even though healthcare is complex, walk in the shoes of the caregiver and the patient and what that's like to walk through the healthcare complex system. It's too much. We've got enough on our plate caregiving for our loved ones at home. Help us with integration, policy changes, and legislation. It can be done, and do it now.